Tennis elbow, or lateral epicondylitis, affects the tendon connection of forearm muscles to the elbow, causing pain on the outer side. Commonly resulting from repetitive activities like painting or typing, symptoms include tenderness, weakness, and discomfort when gripping. Non-surgical treatments such as rest, ice, and physical therapy are often effective. Early diagnosis is crucial to avoid chronic pain, and many suffer without ever playing tennis. Tennis elbow, despite its name, isn't limited to tennis players. It's a common condition that causes pain on the outside of the elbow. Here's a breakdown. Understanding tennis elbow. What it is. Tennis elbow, also known as lateral epicondylitis, involves inflammation or micro-tearing of the tendons that join the forearm muscles to the outside of the elbow. Specifically, it affects the tendons that extend your wrist and fingers. Causes. Overuse. Repetitive motions of the wrist and arm, such as those involved in racket sports, tennis, squash, etc., painting, carpentry, computer use, any activity that repeatedly stresses the forearm muscles. Symptoms. Pain and tenderness on the outside of the elbow. Pain that may radiate down the forearm and into the wrist. Weak grip. Pain when gripping or lifting objects. Pain when extending the wrist. Treatment. Non-surgical. Rest, avoiding activities that aggravate the pain. Ice, applying ice packs to the elbow for 15 to 20 minutes at a time, several times a day. Pain relievers. Over-the-counter or prescription medications to reduce pain and inflammation. Physical therapy. Exercises to strengthen and stretch the forearm muscles. Bracing. Wearing an elbow strap or brace to support the tendons. Corticosteroid injections to reduce inflammation. Surgical. Surgery is rarely needed, but it may be an option in severe cases that don't respond to other treatments. Key points. Early diagnosis and treatment can help prevent the condition from becoming chronic. It's important to identify and avoid activities that contribute to the pain. Even though it is called tennis elbow, many people that get this condition have never played tennis. I hope this information is helpful.